Alrighty, it looks like everybody's here, and it's about that time. So we're just going to get started. Hi, everybody. Welcome to our fourth and final week of major joint rehab. So far, we've done major joint rehab, shoulder, elbow, hip, and this one is knee. So we're going to be focusing on the knee this week. If you missed any of the other weeks, you can go check it out on our YouTube channel. All you have to do is just search up Corthicare, one word, in YouTube, and it should pop up. If you want to find this specific one, if you just type Corthicare knee, that should be one of the first videos that pop up, I believe. So without further ado, let's get right into everything. I'll talk a little bit about our next webinar series in August towards the end. And as always, if there's any questions, there is a question and answer function at the bottom, as well as a chat function, which you guys are welcome to use throughout. Alrighty, so like I said, this is major joint rehab week 4, where we're talking about the knee this week. So this is our last one, just a heads up. So this week, we're talking about the knee. So some common injuries to the knee are meniscal tears, ligament sprains. So you might have heard of somebody tearing their ACL or MCL, PCL, LCL. So these are all the ligaments that just hold all the bones of the knee in place. They're really big, really strong, but they can tear, and those tend to be pretty serious injuries. And of course, arthritis of the knees is pretty common. That's something that a lot of people deal with. So these might all be something that you guys have experience with, or people in your lives have had experience with. And as usual, we're going to be doing our usual routine. We're going to be doing 3 sets of stretches and 3 sets of exercises. So we'll go through each of them. And as always, if you have any questions, please feel free to ask. I'll try to get to them as quickly as I can. And if not, I always set aside a couple of minutes at the end of the webinar, just in case anybody has any last minute questions that they can think of. Alrighty, so some quick anatomy. I always like to go through this beforehand so we know what we're working with. So as you can see, there's a ton of muscles that cross over the leg. We can just see the front here, but there's a number of muscles on the back as well. So we've got our quadriceps, which is actually 4 muscles. We've got our hamstrings on the back, which cross over, and we've got our calves, our gastrocnemius and our soleus, which cross over as well. So we're going to work all those different muscle groups today. And here you can see on the screen, if you can see my mouse, here's all the ligaments I talked about. So it's mainly these ones on the outside and these ones in the middle that people tend to injure. So we're going to try to do these exercises and stretches to avoid doing this in the future. So some general exercise reminders. We're just going to be doing 1 set of each exercise today, but typically if you were to do this on your own time, you'd want to do about 3 sets of 12 to 15 reps. So that means you're going to be doing the motion 12 to 15 times, take a 30, 40-second break, and then we're going to do it another 12 to 15, 30 to 40-second break, and then the third and final one. I like to go through ways to make these exercises a little more difficult, just so, or a little easier depending on your experience level, so you can individualize it for what you need. For timed exercises and stretches, you want to hold them for about 15 to 30 seconds. You don't really get much benefit if you hold for shorter. And if you hold for longer, there's no additional benefit. You're just putting extra stress on the muscles for no reason. So 15 to 30 is that window that you want to shoot for. And of course, you can change the time and intensity to your individual preference. And I will talk about how to change some of these exercises in difficulty. Alrighty, so without further ado, I'm just going to adjust my camera here, make sure you guys can see me okay. And we're going to get started. Alrighty, so first we're going to start with some calf raises. These are nice and simple. I'll lower this a bit so you can see my feet, but these are real easy, really straightforward to do. You're just going to get something that you can like hold yourself steady against, and then you're just going to go up on your toes, down. Oh, actually, I'm sorry, we're not doing that just yet. I'm reading the wrong part. First, we're going to do a calf stretch before we exercise it. So this one's even more simpler. We're gonna put our feet up against like a wall here or something. Something you can see. So I've just got this bit here that I'm gonna put my toes up against, but you can do it up against a wall. That's the easiest. So you're gonna put your foot up. You're gonna bring your knee as far forward as you can until you feel a good stretch in your calf. Normally for me, it doesn't take too much of bringing my knee forward. And then we're just gonna hold that for 15 seconds. So I'd say holding it for 5, so 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And then we're just gonna switch legs here, hold it up, and for 15 more. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Perfect. Alrighty, so next we're going to be doing the standing hamstring stretch. So the hamstrings are these muscles on the back of our upper leg here. So what you're going to do is you're just going to, with balance, you can hold something to keep yourself steady if you need. But what you're going to do is you're going to cross your legs over like this, have your feet close together, and then you're just going to hinge at the hips and lean down and try to touch your toes. And on the back leg, you should feel a bit of a pull as you lean forward and try to go down. So we're going to hold this for 15. So 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And then we're going to switch and cross the other leg in front. And remember, you can hold something for balance if you need. We're just gonna, a little close there, and we're just gonna lean forward. And again, you'll feel that stretch on the back leg as we reach down towards our toes. I normally have tight hamstrings, so I can't touch my toes, but here we'll keep going. 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Perfect. So that is our second set of stretches done. Now we are going to move on to our third set of stretches. I'll just fix this here so I'm not talking with my head cut off. How about that? So next we're going to do our third set of stretches. So this one, you probably will need something to balance. So I'm just going to hold this wall here. But what you're going to do is you're going to bring your leg up. If you can't grab your foot, that's fine. You can just bring your leg up and just kind of pull it back a little bit. But if you are able to, it's good to grab your foot just so you can get that extra little pull and you don't have to lean as much. So you just hold here and you'll really feel the pull in the front of your legs here. So we're just going to hold it for 15. So 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Then we'll switch legs. We'll go to the other side. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Perfect. And then you can just shake it out if you want, and we're all done our stretches. So now we're going to move on to our exercise portion. So I'm going to lean this back down again just for this first exercise, because we're going to be doing calf raises, which I mentioned briefly before, but here we're going to get into them. So basically you're going to stand and have your toes facing forward, but shoulder width apart. Hold on to something for balance, and then you're just going to go up onto your toes and down. And that's 1. So we'll go 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Perfect. And that's all we need to do. That's one whole set. If you want to make these a little more difficult, you can do something like go to the stairs what you can do on the stairs is you stand and you just have your heels slightly off the back of this. Only if you're comfortable. Once your heels are off the back, you're just gonna do the same motion, up on your toes and back down, just with your heels kind of hanging off. So you go through a more full range of motion. It's just up and down. Perfect. All right, so next we are going to move on to our next set of exercises. So for these ones, they're just called hip extensions. So what you got to do is you're just going to stand and you're just going to bring your leg back and you'll feel a bit of a pull right in your hamstring here. And that's it. All it is just putting your leg back. So that's 1, 2, 3. You don't want your leg completely straight. You want to have a little bend in it. 4, 5, 6, 7, 8, 9, 10, 11, 12. Perfect. Now we're going to switch legs. I'm going to look this way so you guys can see that my legs are just going straight back. So we're just going to go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And that's all it is. It's just leg back and down. And remember, 12 each side. Normally we do 3 sets. Today we're just doing 1 because of time. And now we are on to our last exercise for today. These ones we've covered in past webinars, but they're just so great for working the quads out that we're going to do them again. They're easy. You can do it pretty much anywhere. And they're just called sit stands. And it's all in the name. You're just going to, using your legs, not pushing on your legs or anything like that, just going to stand and sit. And that's 1. And remember, so we're going to do 12. And all it is stand and sit. If you have a chair with armrests, you can use the armrest for balance. Just make sure that you're not pushing yourself up because then you're taking away from the workout on your legs. So we're going to go 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And that's the last of our exercises. So if you want to make that one a little more difficult, you can hold some weights, or like a soup can is a good makeshift weight if you don't have any weights on hand. But you can hold some weights and those will add the weight, make it a little more difficult. As for the hamstring, what is it called? As for the hip extensions, for those, if you have an ankle weight, that's really about all I can suggest to make it a little more difficult. You can always add reps if you want, or add an entire set if you need. But I suggest that to make it a little difficult, at first just look for adding weight to the exercises. If you want to make them a little easier, for these ones more so, you just have to go with less sets. And so we're just going to hop back over to our PowerPoint here just to finish out. So remember, or some quick reminders, sorry. We're going to perform about 12 to 15 reps, and we're going to do 3 sets of each. So we're doing the 12 to 15, 3 separate times. For the timed exercises and stretches, you want to hold them for about 15 to 30 seconds. There's really no benefit from holding it shorter, and there's not much added benefit for holding it longer. So that's the window you're searching for. And as always, work within your comfort zone. Don't push yourself too much because that's how we get injured, and that would just stop us from achieving the goals that we want. So just really stay within your comfort zone. That's really important. So here's our final slide. Remember, if you feel any popping or grinding sensations while you're exercising, and it's just constantly happening, you should probably get that checked out. It's, yeah, like you don't want to accidentally make something worse, and it's good to catch it early just to be sure that you don't injure yourself further. And always be sure to stretch. Even if you are exercising regularly, extra be sure to stretch. But even if you're not, stretching is a great way to strengthen muscles. It's a great way to just get blood flow and nutrients to the muscles. I really encourage stretching as often as possible. It's really great for you. As always, there's the question and answer function. If you guys have any questions right now, put in the chat, put in the Q&A, and I will answer. So for our next series, we are doing a back to school webinar series. So we're going to be talking about stuff like headaches, maybe a bit of like mindfulness. We'll also be talking about posture. So when you're carrying a heavy bag, what's ways that you can make it a little easier for yourself and on your body. We're going to be covering a whole wide range of topics like that. So that's going to be starting Friday, I believe August 6th. It's the first Friday of August. So yeah, we'll be starting then. You guys will be able to sign up either through the Instagram, which I'm guessing most of you signed up through, or I believe we send out a mailer, or you can just ask about it in clinic and we can, I can get you set up in there. So yeah, that's the end of it. If there's any questions or concerns or anything, ask away. Otherwise, thanks for tuning in, guys, and I hope you enjoyed this webinar series. It looks like there's not too many folks left. I'm not really seeing anybody typing or anybody hitting the Q&A function. So I think we're just gonna call it there. Again, thanks for tuning in, guys. Hoping to see you at the next webinar series, our back to school series. Thanks.